What's going on? This is David from Elevated Physical Therapy and Fitness. Today I'm going to go over a few things for your wrist and elbow, including some nerve glides for a couple of the most commonly involved nerves when you're having issues, but also just some general wrist mobility and elbow mobility for helping to get into a front rack position or something else that it might be bothering you with. So first of all, if you're having just wrist discomfort during like a compressive type exercise, some kind of pushing or push-ups or something like that, and it's only when your wrist is back like this, that's really kind of more what we're working on here. But just giving yourself a little bit of distraction at the wrist, so you grab right at the wrist joint and kind of pull out from there, that's just enough to gap that joint, and sometimes that's enough and you can get by on that. So do that for a set amount of time, minute or so, and go try that compressive exercise, and sometimes that's enough to relieve that discomfort. So it's a really easy pre-activity warm-up type of thing that you can do. Sometimes that's not enough and you need to get a little bit of mobilization going on at that joint as well. So if you have some type of surface here that you can get a little bit of weight bearing in, you're going to use your opposite hand to kind of push those wrist bones down as you bring the arm bones over the wrist. So again, I'm here, and before I get into that wrist extension, I'm going to push that down, and I'm getting some of that distraction from that. So I'm getting that distraction, but I'm also holding that there so I can get that mobilization, and then I'm coming forward here. This is very similar to the banded ankle joint mobilization that we've done in previous videos over at the bench. But I'm here blocking that and bringing that forward. You want to be careful. Don't push into sharp pain, much like all the other joint mobilization videos that I show. You don't want to be pushing into that. Okay. So that's one just to increase that wrist extension range of motion. And a couple of the nerve glides that you can do there. Depending on what nerve is bothering you, and you would need to speak with somebody about this, but you can get into here, you can rotate this, and that just helps to sensitize and desensitize. Okay, and then for the other, you're gonna come out onto the wall, rotate up, rotate down. So this is more for a median nerve, that other is more for your ulnar nerve. The flatter you get against this wall, the more intense that stretch is going to be, not only for your forearm flexors, but the nerve itself. I wouldn't recommend being way out in that like really stressed nerve position for too much longer than a few seconds at a time. So that's why that, moving in and out of the motion, that kind of flossing action almost is probably the most appropriate, just from a comfort standpoint, but also just so you're not putting like way extra tension on those nerves that doesn't necessarily need to be there. If you're dealing with nerve issues, numbness, tingling, things like that, you really should be checking in with a PT or your physician or some other provider prior to doing anything that you're seeing on these types of videos, because nerves are obviously a lot different than your muscles and things that you could maybe work through. Nerves are something that need to have a little bit more guidance, but give those few things a shot, especially if you're having some wrist discomfort during things or even elbow, and let me know what you think.